Apoptosis. Apoptosis is a form of coordinated and internally programmed cell death. Apoptosis normally occurs both during embryogenesis and through the adulthood, where it is served to eliminate the unwanted age or potential harmful cell. It may also be pathological in an event when the diseased cell become damaged beyond the repair and are to be eliminated. Apoptosis is physiological process. Example: organized cell destruction during development of tissue in the embryo as per requirement. Endometrial shielding during menstrual phase in uterus. Regression of lactating breast after the withdrawal of breastfeeding. Apoptosis in pathological process. Progressive depletion of hyper T cell, CD4 cell. It is pathogenesis of AIDS, cell death by cytotic T cell in the immune mechanism, cell death in viral hepatitis, tissue necrosis in acute myocardial infarction, degenerative disease of CNS. Example: Parkinson disease, Alzheimer's disease. Biochemical changes in apoptosis. Photolysis of the cytoskeleton protein, protein cross-linkage, fragmentation of chromatin, appearance of adhesion, glycoprotein of the outer surface of the apoptosis body. Molecular mechanism of apoptosis. Initiator of apoptosis. Apoptosis is usually initiated by a programmed cell death mechanism which may take place by withdrawal of normal cell survival signal, absence of certain hormone, growth factor, cytokine, etc., antigen of cell injury, heat radiation, hypoxia, toxin free radical, etc. Pathway of apoptosis. Increased pathway, mitochondrial mediated. Increased mitochondrial permeability, release of cytokine C from mitochondria. Procapsin, CAPS 3, 6 and 7, apoptosis. Extrinsic pathway, cell death receptor initiated. Activation of cell death receptor, TNF-R1 plus FAS. Procapses 8 and 10, capses 8 and 10, capses 3, 6, 7, apoptosis. Phagocytosis. The dead apoptosis cell develop membrane change which promote their degradation by the phagocytosis. The phagocytosis molecules appear on the culture surface of cell apoptosis, which their infraction and further process of phagocytosis.